Hello, everyone. It is a pleasure to be here with all of you participated in the Forum for Health Innovation. I would like to greet José Villar for his initiative. Here, we can bring together specialists of healthcare to share knowledge. I would like to thank my guests, very special speakers, Daniel Balaban, a partner of ours, a representative of UN in Brazil representing the World Food Program. And he's going to talk about hunger and malnourishment in Brazil. And Dr. Van Waitzberg, a nutritional specialist responsible for the largest nutritional congress in Latin America called GANEPAN, and he's going to be here talking about the impacts of malnourishment in health. Our panel is focused on nutritional and health and the impact of hunger and malnourishment. And we've been hearing a lot about hunger, especially now because of the pandemic. In 2020, 270 people suffered of acute food shortage, which is very alarming. I'm going to share that with you. Danielle, can you go first and tell us about hunger and malnourishment here in Brazil? Well, Andrea, good morning, everyone. It is a pleasure to be here participating at FIS. The number that you have just shared, 270 million, is the number of people in what we call food and nutritional insecurity. This is the topic that we've been using in the world. There are about 810 million people who right now do not have what to eat. This is really unacceptable because it's a planet with so many scientific, technological breakthroughs. We know how to solve this problem, but as human beings, we still haven't decided to put an end to hunger and food security in the world. We need a political decision of human beings, of people, and as such, the same will continue. And it's very sad to have so many people in such situation in the world. In Brazil, there is right now, according to the latest research, there are about 20 million people in situation of severe food insecurity. A very large country, a rich country, one of the main exporters of food and grains in the world. It's really unacceptable to have a situation such as this in which 20 million people are subject to severe food insecurity and malnutrition. People who have absolutely nothing to eat today. They are depending on the donation of other people or maybe corporate who can help them have access to food. Now, speaking of food insecurity and or moderate food insecurity, there is an even larger number. What is moderate food insecurity? These are people who have access to food, but not nutritional enough, not appropriate. We call them ultra-processed foods, and I'm sure Dr. Waitzberg can talk more about that. They're not real food. They are items full of chemical substrate. So, of course, people will eat not to feel sick. If you eat anything when you are hungry, you no longer feel pain, so you think you are properly fed, but nutritionally, I'm sure these people are not well nourished. We need appropriate nutrients. So people in Brazil are undergoing this situation. It's something which got worse because of the pandemic. And this is a moment that we have to discuss public policies so that we can really deal with this situation and try to avoid the increase of the number of people in this situation. Of course, there is a solution, provided that we can discuss problems and apply the right pressure for public policies to be adjusted to treat these people. Thank you for your explanation, Daniel. And this is one of the ODS, the Sustainable Development Goal, SDG, and we are far from reaching the Sustainable Development Goal of the UN that has been set. But following this segue, we know that malnutrition causes health impacts. What are the main consequences of malnutrition to health? Good morning, everyone. Thank you very much, Andrea, for inviting me. It's a pleasure to be here with Dr. Daniel and Balaban. I would like to first understand technically that malnutrition is the lack of macro and micronutrients and primarily of protein because it costs more. A chronic protein deficit impacts a number of organic systems, including our immune system. So the defense against infections goes down, and there is a problem in healing. They have anemia, fatigue, short of breath, kidney and heart disease. Children will have failure to thrive. In women, we might see amenorrhea and difficulty to get pregnant. And in addition, there is occult hunger, hypovitaminosis because of no injection of fruit, vegetables. And in Brazil, there is also hospital malnutrition. According to our studies, in inpatients, 48.1% are malnourished and 2.5% are severe malnourished, according to this Brazilian report. In Brazil, in each hospital admission into a public hospital, there are between 28 to 33% of malnutrition, especially among the elderly. And the causes include primary malnutrition, as Dr. Balaban has just mentioned, plus there is also secondary malnutrition, which is the underlying disease, and tertiary one, which is healthcare professional unawareness about nutritional status of professional. As a consequence, there is an increase in infectious and non-infectious disease, more hospitalization, hospital readmission, more time of hospital stay, higher mortality rate, difficulty of chronic wound healing, such as pressure ulcer, weight reduction, and a low nutritional status and low BMI. Malnourished subjects cost more at the hospital than those that have no malnutrition. And finally, we have to consider specific groups, people who are treated, for example, for cancer. In such case, malnutrition reduces the tolerance to oncology treatment, meaning they cannot complete their chemotherapy and radiotherapy. They lose weight, they stay longer in the hospital, and as such, it is the group of elderly patients who are much more vulnerable to malnutrition and complications for a number of reasons. But they have sarcopenia, which is physiological, but it gets worse when there is no consumption of protein. It reduces lean body mass. 18% of people over the age of 65 years have sarcopenia in Europe, let alone here in Brazil. In addition to all of that, those with malnourishment have apathy, low self-esteem, and very poor quality of life. It's unimaginable to not consider nutrition and eating on health. It's impossible to talk about health, ecosystem, and prevention if we don't talk about nutritional status, in addition to hunger and food insecurity. W, uh, WHO estimate that malnutrition is the main problem of public health, with 278 million children with malnourishment in the world. Daniel, in your opinion, do you think that the universal healthcare system here in Brazil is also impacted by malnourishment? I am one of the main advocates of the SUS, the Universal Healthcare System in Brazil. We have created a system that has problems. Of course, it's far from being perfect, but if it weren't for it, the situation would be much worse than what we currently have. SUS in Brazil can still save lives, and it's present in all cities of our country. The problem of public health caused by malnutrition, as Dr. Waitzberg has told us, is one of the factors that really increases the cost of healthcare system in any country. I work also supporting other countries to create public policies to fight hunger and malnourishment. And it's much harder in countries where there is no public health system, including the United States, where there is an increased number of obese patients. It's a developed country, which does not have a public healthcare system that covers the entire population, and experience every year many deaths caused by ultra-processed foods that have no micro and macronutrients. It all leads to diseases. Many of the diseases that we currently see in countries is a result of what we eat, of what we take into our bodies. We have to realize that it's high time we started taking good care of ourselves. We have enough information. There are great specialists all the time explaining what good foods are for us. But at the same time, there is a portion of the population that they cannot afford appropriate food items or protein-rich foods because it tends to cost more. In Brazil, there is plenty of food, but people have no access to foods because they cannot afford to buy them. So our problem is more of economic than health, and everything is interconnected. Differently from countries where I work, where there is no food because they have no production of food. So even those who have money cannot purchase foods because they are not available. Differently from Brazil, where food is available and people do not have access to it. And it ends up costing more to the healthcare system. More malnourished people, higher the cost, as we've heard before. It would be much better to invest in prevention of malnutrition through public policies to prevent malnutrition and food insecurity than investing resources in the public healthcare system to treat the diseases that resulted from inappropriate eating. I heard a specialist speaking about the regions of conflict where there is no access to food, the climate, the places where climate impact production of foods. There are some countries in Africa which are constantly affected by that, migration from rural areas into the center, and the sea of crisis, which is our case here in Brazil, of low income levels. It's impossible to improve food insecurity and access to food. 20 million people that you mentioned, without really addressing job and income, job creation and new income levels. Well, Dr. Waitzberg, you talked about healthcare and how much its impact, but in your opinion, what are the main impact that it brings to healthcare systems, and what is the best clinical and nutritional initiatives to deal with malnutrition? The numbers you mentioned of 48% of inpatients in Brazil having some level of malnutrition, which has a direct impact on their care. The healthcare system is going to be impacted. These are patients who need more antibiotics, more medication. They stay longer in the ICU. They take longer to recover from surgery, so they stay longer in hospital. And of course, there is a cost to it. It's not only money, because if they get into the hospital and they are not discharged, there is no other patient coming to the hospital. So there are two additional costs here. But on top of that, there is also mortality, which is much higher, 3 times higher among malnourished patients. It costs a lot to patients, to society, because the society has invested with no significant results. And how can we deal with that in hospitals? The first thing we have to do is diagnosis. We have to identify patients who come into the hospital. This is a study published by one of the trainees in our university. 28% of the patients who get into our hospital, the clinics, have malnutrition, but they are not recognized as such. Well, of course, it exists in many places, but this is not generalized. So we really have to do our best to bring nutritional awareness of the patient, the healthcare team. They have to be aware that they have access and should have access to nutrition. Once we diagnose it, we can also make use of well-established nutritional therapy. So oral supplement, Enteral, through tubes that can be placed in the stomach, and that's going to use specialized diets, and also in those that cannot use oral access of food, we can resort to parenteral nutrition, which is also fully developed and done very safely. It's very important to tell our listeners that Brazil has all these options, what's available in Europe, in the US, of enteral nutrition, parenteral nutrition. We have it all. We have substrates, tools, and qualified teams. So what is the problem? Why doesn't it work? We get back to the issue of cost. It has high costs and it takes investment. But I fully agree with Dr. Daniel, because prevention is the most important thing. If the patients got to the hospital without having malnutrition, great. So nothing else would be necessary, apart from those that, of course, have sepsis or major burns, which is the case of patients with COVID, for example. We've seen it happening, many cases of malnutrition. Physicians realize the importance of having good nutrition when patients would simply end up getting worse and worse overnight because of inappropriate nutritional status. So I really think that we have to monitor patients closely. A key example for it is the work, and I work in the Cancer Institute of Sao Paulo, and there we have lots of patients, of course, one of the most important public centers that treat cancer patients, and we use the most modern therapy there.
Only here we know, due to social services, that there is a part of those patients that cannot even afford the bus ticket. And then I wonder, I've always wondered that we provide nutritional therapy with a wonderful team, we have that. And then I wonder, you invest in chemotherapy, radiotherapy for a patient that cannot afford the bus. Are they eating protein? Well, thank goodness this hospital has a service that is public for providing oral supplements and also enteral nutrition for specific cases. But they're not all so much so that if you encompass all this population, there's not enough money. So these are severe problems, very well approached previously. Everything comes before prevention. That is the focus, and not intervention. That, well, we are there, but the value is limited. So, Dr. Dan, in your view, the system is not prepared to provide all this care. And you've talked a bit of supplementation, oral supplements. It does not all happen in all hospitals. What is your view on this? Look, I believe that the health system is prepared. First, let's talk about professionals. It is important to say that Brazilian nutritionists are the most skilled worldwide, and I attend conferences worldwide. I know nutritionists from the whole world and Latin America, and I must say that Brazil is way ahead in this regard. Our public health system, so since 1997, thanks to a task force that we had the privilege to direct when I was chairman of BRASPEN, our society, it pays the enteral nutrition inputs that places Brazil at a standing out position in Brazil in Latin America. So we have 97 countries where this is paid. So we've always paid for the kind of nutrition for many years. What Brazil does not pay yet is parenteral nutrition and the home care that in many cases is necessary. Once cancer treatments are more necessary, so enteral nutrition exists. It goes through the Secretariat of Health by a rigorous filter. There have been abuses, but what Brazil does not pay from the public standpoint are oral supplements. Oral supplements have proven important in reducing malnutrition and all the other complications that I've mentioned. But many patients cannot be fed orally in hospital, but they can drink those supplements that actually are quite sophisticated. Yesterday, I tried a soup, a supplement, a sauté with like green peas or asparagus. I liked it a lot. However, the public system does not pay for that. There's been an effort from society to actually try to lobby Visa, the surveillance agency. There's been a public consultation, but it this measure has not been approved. It's understandable that it hasn't been approved because if you imagine the amount of resources that this will be required from the government is a lot. And this is something that deserves in a country with severe financial difficulties, as we read in the papers every day. It's difficult to approve just now. And lastly, well, which does not mean that we should stop investing in this aspect. We should continue because one day the situation will be improved and we'll be able to move forward. What I'd like to emphasize once again is that over these 40 years that I've been devoting myself to nutritional care for hospitalized patients, I see there is a much greater perception of doctors regarding the nutritional aspect of patients. Certainly, a lot has been done, so said, but the sick patient has not yet understood that they have the right to be nourished or fed. When the patient gets to the hospital says, I cannot eat this kind of food, how are you going to be concerned about my nutrition? So the family member says, doctor, my husband hasn't eaten for 3 days. So you know that in the clinic's hospital, the average time of fasting of patients is 3 days. This is a survey we carried out along with nutritionists in the hospital. It is normal for somebody to imagine to spend 3 days in a hospital without eating. And this is sufficient to actually degrade your immunological system. Well, Andrea, if you want to lose weight, just hospitalize yourself and then you lose weight immediately. So patients have the right to demand to be fed. If we consider all of this, we're going to evolve a lot. Thank you very much, Dr. Dan Waitzberg. That was one of the questions I was going to ask you, actually. How society overall can create this awareness that patients are entitled to this nutrition. Very good. Daniel, going back to you, what can society do to avoid this impact to the system in your view? Well, I am not from the healthcare industry. I am butting in. I'm working. I like public policies, but I've learned a lot because I work a lot. As Dr. Waitzberg said, I am surrounded by nutritionists, but taught me a lot. I read that the father of medicine, Hippocrates in ancient Greece, he said that food is your greatest remedy. At the time, when you imagine before Christ, he knew it. It is food that is the best remedy. If we want today, in all countries of the world, people know that the public health system is very expensive. The US do not, they do not have one because they know for the price how much the public health system would cost. Brazil has a public health system. Dr. Waitzberg mentioned that it could be more active and doing more things if they had greater budget. But I say the following, that we could have an increasingly better health system if we also treated our diets as something number one in our diets, in our lives. If we started thinking what we intake. So I've abolished for a long time after having understood the evil of soft drinks, pure sugar. A can of soft drink is more of what you need in sugar in 2, 3 days that you drink in a can of soft drink. You learn that because people don't talk about that. And people start learning on the day-to-day, the debates, the talks with people that are the experts. So we start understanding better the importance of good nutrition and also how our body reacts to certain types of food. And I believe that the generation of my children will be much better, much healthier than my generation has been, or Dr. John Waitzberg's generation, because they start by knowing that today. Well, very short time in Brazil that food, we have the nutritional aspect of food stuffs. Before the 1980s, we didn't have that on the label. So we had the product with a fantasy name or a brand name. Nobody knew what it was in this month. In the 80s, 90s, after the Constitution, people started putting nutritional aspects of each food item. And I'm in favor for us to put bans as it's done on cigarette packs saying this may lead you to death, this may cause cancer. People should put some bans in certain food items that are put on supermarket shelves that may cause diabetes or other problems related to health that may lead, if people take a lot, it can lead to health issues. This may cause serious health issues. High intake of the food. The power is in the hands of people today. Northern countries that I like to use as example, they have more appropriate food system and the less burdensome health system because they discuss this all the time. They address prevention through nourishment so as not to have the burden later. It's much more intelligent for you to prevent. It is time for us, Brazilians, to start working and talking more about these topics. Why are so many people malnourished? Why there is hunger in Brazil? Brazil is a country that has a lot of resources. We have to start discussing where the public budget funds go to social policies to confront these questions. This comes from the population. If the population does not start to discuss, does not care about that, the decision will be in the hands of very few people that make a decision based on their personal interests. So it is high time people insert themselves more in this process and debate these questions more and talk about this. Events like this are extremely important for us to clarify to the population, to people on their rights they have many times they are not aware of. So it is time. So I like the decisions and revolutions, quote unquote, come from bottom up, never from up and down. So clarifying to the population or the clarification of population that will make public policies to adapt to the interests of population. Once the population does not demonstrate its interests or does not know about the importance of that, things continue the way they are. And we'll be here in 5 years' time discussing once again why there are so many people dying of hunger in Brazil and in the world. So it is high time we make a change. The change is through everyone when people are aware of the importance of taking part in public life and the debate, and also start being the example of what they want for the world. The example starts from us. So it's no use of wanting that the other should do and we don't do. We have to set the example. They should see in ourselves. We should be role models of what we want to do for the world. So that's why the population has an extremely important role if it is well guided and well conducted. Thank you, Danielle. We could be here listening to you for a long time. It is a topic that brings a lot of questions to us. We ended up not even talking about obesity, that is on the other side of the token, because many times people think that obesity people are nourished because they're obese, and totally the opposite. For us to wrap up, unfortunately, we're almost out of time. I'd like to ask Dr. Dan Waitzberg to give him final message. And what drew my attention was the aspect of doctors, the clinical staff to be more evident to them, the role of nutrition with COVID. So the impact of nutrition, the importance of nutrition in recovery of COVID patients. You've also talked about elderly people that was the most impacted with regarding malnutrition in addition to children, and we've talked about what takeaway message would you like to share with people that are watching us, healthcare professionals watching us regarding nutrition, the importance of nutrition in this whole health ecosystem? Well, sure. I believe that the message I'd like to leave with you is that nutrition is an integral part of the treatment of the patient. Actually, the first item in medical prescription is food, diet X, diet Y. However, people do not observe whether the patient has eaten or not. I'm going to end with a piece of data. The SBN, the Nutrition Society in Europe, they have for many years a nutrition day. They evaluate hundreds of hospitals worldwide, only one day. Up from top to bottom, the results are the following. Those that eat 50% of the plate on that day get complicated and die more than those that eat everything. But those that eat 25% of what is served to them, they compete twice more than those that eat half. The one day has the prognosis value. So let's look at what our patients are eating. It is much more valid for you to look at what the patient is eating than rather measuring that or that and that. Our data are elderly, lost weight, hasn't eaten, will have complications. This is what I wanted to say. Thank you very much. Well, unfortunately, our time is up. We are at the end of this conversation, this chat. We could stay here for a long time. I'd like to thank all of you at home following our debate. I'd like to thank very much Dr. Dan Waitzberg, Danielle Balaban, for your availability, for sharing this knowledge, of bringing a lot of reflections that are very important to us as individuals, as society, and also within the health segment, how we can unite public policies regarding health prevention, thinking in the nutritional aspect that is so important and so impactful, especially in Brazil, in our country. So I would like to thank you very much for your time, for the FIS Initiative organization, and we conclude our panel of today. Thank you.